Hey everyone, and welcome to another deep dive. Today we're taking a closer look at the exciting world of prostate cancer diagnosis.
Exciting might not be the first word that comes to mind for most people.
Yeah, well, okay, maybe not exciting for everyone, but you gotta admit that staying on top of the latest advancements in diagnosis is pretty important.
Absolutely. Early detection is key when it comes to prostate cancer.
Exactly, and that's why we're diving deep into the differences between biparametric and multiparametric MRI.
Or, as you might hear some folks say, bpMRI and mpMRI.
Right, bpMRI and mpMRI. These are two powerful imaging techniques that are helping doctors detect prostate cancer earlier and more accurately than ever before.
And that's a game changer for patients.
You know, we always talk about the importance of being an informed patient, right?
Absolutely. Knowledge is power.
And that's especially true when it comes to your health.
Right. The more you understand about the diagnostic tools available, the better equipped you'll be to make informed decisions about your care. So today we're going to break down these two techniques, compare their pros and cons, and help you figure out which one might be the best fit for you.
That sounds like a plan.
And to guide us through this deep dive, we're joined by a true expert in the field.
Happy to be here.
All right, let's jump right in.
Okay, so let's start by acknowledging that this can be a really sensitive and sometimes confusing topic.
Yeah, prostate cancer is definitely not something people like to talk about.
But it's incredibly important to have these conversations and to arm yourself with the knowledge you need to make informed decisions.
Exactly. No more sweeping things under the rug.
Right, we're shining a light on prostate cancer diagnosis. So where do we start?
Well, before we get into the specifics of bpMRI and mpMRI, let's set the stage a bit. Give our listeners a little bit of background.
Sounds good to me.
What's considered the gold standard for diagnosing prostate cancer right now?
Well, the current gold standard is multiparametric MRI, or mpMRI, as it's often called.
Okay, so mpMRI, that's the big dog, the top player in the game right now. But what exactly is mpMRI? I mean, what's going on inside that big donut-shaped machine?
Well, it's actually pretty fascinating when you break it down.
I'm all ears.
mpMRI combines three different types of imaging techniques to create a detailed picture of the prostate gland.
Three different techniques. Wow. Okay, so like a triple threat. What are they?
All right, so first you've got T2-weighted imaging, or T2WI for short.
T2WI. Got it. What does that do?
This one gives us a really clear anatomical image of the prostate. It shows us the structure, the zones, and any areas that might be abnormal.
So it's like a high-resolution roadmap of the prostate.
Exactly, a very detailed roadmap.
Okay, that's one. What about the other two?
Next up, we have diffusion-weighted imaging, or DWI.
DWI, another acronym. I'm taking notes here.
Now, DWI focuses on how water molecules move within the prostate tissue.
Water molecules, huh? Okay, I'm listening.
Cancerous cells tend to be more densely packed together.
Oh, I see where you're going with this.
So they restrict the movement of water.
Makes sense. So DWI helps pinpoint those areas where the water's not flowing as freely.
Exactly. It's like a little detective looking for those subtle signs of trouble.
So we've got T2WI for the anatomy, DWI for the water movement. What's the third piece of the puzzle?
Yes. The third one is called dynamic contrast enhanced imaging, or DCE.
DCE. Okay, that sounds fancy. What's that all about?
Well, for this one, we inject a special contrast agent into the bloodstream. This agent highlights areas with increased blood flow.
Increased blood flow, and why is that important?
Because tumors tend to have a lot of blood vessels. They need that extra blood supply to grow.
So the contrast agent lights up those areas like a Christmas tree.
Pretty much. And by analyzing the patterns of blood flow, we can get even more clues about which areas might be cancerous.
So mpMRI, it's like having a superpowered magnifying glass for the prostate.
I like that analogy. It really does give us a comprehensive view.
You mentioned earlier that mpMRI is the current gold standard for prostate cancer diagnosis.
Yes, it's been the go-to for quite a while.
But in the intro, we hinted that there might be a new kid on the block.
Great. There's a new player entering the game.
So let's talk about that. What is this bpMRI? What does it stand for? And how is it different from mpMRI?
Well, bpMRI stands for Biparametric MRI.
Okay, biparametric, so 2 parameters instead of 3. Which one's missing?
You got it. bpMRI actually omits the GCE sequence, the one with the contrast agent.
Interesting. So it relies on just the T2WI and the DWI, so a simpler, more streamlined approach. But why would doctors even consider doing that? I mean, are we sacrificing accuracy for speed here?
That's the million-dollar question, right?
Yeah, is bpMRI good enough? Can it really hold its own against the gold standard?
Well, that's what researchers are trying to figure out.
Okay, so let's dive into that research. What are the potential advantages of bpMRI? And does it actually stack up against mpMRI in terms of accuracy?
All right, let's break it down. So first off, The potential benefits of bpMRI are pretty significant.
Yeah, tell me more about that. What are we talking about here?
Well, for starters, it's a shorter scan time. Think about it. No contrast injection means you're in and out of that MRI machine quicker.
Okay, shorter stand times. I'm sure patients would appreciate that.
Definitely. It can be a much more comfortable experience, especially for those who might be claustrophobic.
Right, less time in that little tube. What else?
It's also less expensive. Contrast agents can be costly, and by eliminating that step, you're reducing the overall cost of the procedure.
All right, shorter, cheaper. Those are two big wins right there. Anything else?
Well, and this is potentially the most important advantage. It reduces your exposure to contrast agents.
Okay, and why is that a good thing?
Well, while contrast agents are generally safe, they can very rarely have side effects.
Ah, I see. So by skipping the contrast agent, you're potentially reducing the risk of those side effects.
Exactly. And for some patients, that peace of mind is invaluable.
Okay, so bpMRI has some clear advantages in terms of comfort, cost, and potential safety. But like we said earlier, the big question is whether it can truly compete with mpMRI when it comes to accuracy.
Right. At the end of the day, the most important thing is that we're accurately detecting clinically significant prostate cancer.
Exactly. So is bpMRI up to the task? Can it deliver the same level of diagnostic accuracy as mpMRI? I guess that's what we need to find out.
Well, to answer that question, we need to look at the research. And there's a very large study that's been making waves in the urology world.
Oh, a big study. Tell me more about this.
It was a huge multi-center study involving 62 radiologists from 20 different countries.
Wow, 62 radiologists, 20 countries. That's a lot of data points.
They analyzed over 400 MRI scans, so it's a really robust data set.
Okay, so a massive study, lots of data, lots of experts involved. That definitely sounds promising. And what were they looking at specifically? What was the goal of this study?
Well, they wanted to see if bpMRI could be considered non-inferior to mpMRI for detecting clinically significant prostate cancer.
Non-inferior. Okay, that's a mouthful. What does that actually mean? I'm not a medical expert.
It basically means that they were trying to prove that bpMRI is not significantly worse than mpMRI when it comes to finding those dangerous cancers.
Oh, okay. So not necessarily better, but definitely not worse.
Precisely. They weren't aiming to show that bpMRI was superior.
Right, just that it was at least as good. Okay, so that was the goal. What did they find? Did bpMRI pass the test?
Well, the results were pretty impressive, actually.
Oh, spill the beans. I'm on the edge of my seat.
bpMRI showed very similar accuracy to mpMRI across a number of key metrics.
Okay, so in simple terms, bpMRI was just as good as mpMRI at finding prostate cancer.
That's essentially what the study showed, yes.
That's a pretty big deal, right? I mean, if bpMRI can achieve the same level of accuracy, but it's shorter, cheaper, and potentially safer, that seems like a win-win.
It definitely has the potential to change the game.
Okay, but here's what I don't get. If both techniques are so similar in terms of accuracy, why even bother with DCE in mpMRI?
That's a great question, and it's something that the study authors also explored.
Okay, good. So I'm not the only one scratching my head here.
What they found was that the DCE sequence only upgraded a very small percentage of cases to a higher suspicion level.
So in other words, it didn't really change the initial assessment all that often.
Right, we're talking about just 3% of cases.
Yeah, 3%. That's tiny.
Yeah.
So DCE isn't actually adding all that much value in most cases.
That's what the data suggests.
Yeah.
And to make things even more interesting, very few of those upgraded cases actually turned out to be clinically significant cancer.
Oh, wow. So not only is it not changing the assessment very often, but even when it does, it's often a false alarm.
That's right, which raises the question, is DCE really essential in every single case?
It's starting to sound like maybe it's not. So this is where things get really interesting, right?
Yeah, this is where the debate starts to heat up.
Because if we can get the same level of diagnostic accuracy with bpMRI without the added cost, discomfort, and potential risks of DCE, that seems like a no-brainer.
It's certainly a compelling argument.
But I'm sure there are some folks out there who are still hesitant to ditch DCE altogether.
Oh, absolutely. There are always going to be nuances and considerations when it comes to making changes in medical practice.
So what are some of those considerations? What are the challenges that we need to think about before we all jump on the bpMRI bandwagon?
All right, well, let's dig into some of those challenges. And trust me, there's a lot to unpack here.
Well,
One of the things that kind of jumps out at me from this study is how they made the decision to do a biopsy. Like you said, they were looking at the accuracy of bpMRI.
right, seeing if it could hold up against mpMRI.
But even when they were evaluating the bpMRI scans, they were still basing the decision about whether to do a biopsy on what the mpMRI showed.
Ah, I see. So it's like they were peeking at the answer key even when they were trying to grade the bpMRI test.
Exactly. It's like, how can we really know if bpMRI is good enough on its own if the doctors are still relying on the mpMRI to make the big decisions?
Yeah, that makes sense. So to really get a clear picture of how well bpMRI performs, we need studies where doctors are only looking at the bpMRI when deciding about a biopsy.
Absolutely. That way there's no bias, no second guessing, just pure bpMRI decision making.
So are there any studies like that out there? Where bpMRI is calling the shots?
Yes, actually there are some really exciting trials underway right now. There's one called the PRIME trial, which is specifically designed to look at how dpMRI performs when it's the primary basis for biopsy decisions.
Okay, the PRIME trial, I'll have to look into that. That sounds promising. So that's one thing to keep an eye on. What else are we thinking about here?
Well, image quality is always a big factor. I mean, garbage in, garbage out, right?
Yeah, if the images aren't clear, it doesn't matter how good the radiologist is.
Exactly. And what's interesting is that the study we're talking about actually found a pretty high percentage of both bpMRI and mpMRI scans with poor image quality.
Really? How high are we talking?
Well, for bpMRI, over 40% of the scans were rated as having poor image quality.
Wow, 40%. That's a lot of blurry pictures.
Yeah, it's a bit concerning. And it highlights how important it is to have high-quality images, especially when we're relying on fewer sequences like we do with bpMRI.
Right, because with mpMRI, you've got 3 different types of images working together.
So even if one isn't perfect, the other two can often compensate.
But with bpMRI, you're taking away that safety net.
Precisely. So each of the remaining sequences, the T2WI and the DWI, they need to be top-notch, crystal clear.
Okay, so how do we ensure that? How do we guarantee those bpMRI images are the best they can be?
Well, there's a lot of discussion right now about the need for standardized image quality. We need to make sure that every facility offering bpMRI is meeting the same high standards.
So like a universal set of guidelines or protocols for bpMRI imaging?
Exactly. We need consistency across the board. Regardless of where you go to get your scan, you should be able to trust that the image quality is going to be up to par.
That makes a lot of sense. I mean, you wouldn't want to get a different diagnosis just because you went to a different hospital.
Right. It shouldn't be a lottery.
So standardized image quality, that's definitely key. Any other ideas out there for addressing this image quality issue?
Well, some experts are even advocating for external certification for imaging centers offering bpMRI.
Oh, interesting. So like a stamp of approval from an independent body saying, yep, this place knows how to produce high quality bpMRI images.
That's the idea. It adds a layer of accountability and helps ensure quality control. It gives patients that extra peace of mind.
Yeah, I like that. I mean, when it comes to something as important as cancer detection, you want to know that the people reading your scans are using the best possible images.
Absolutely.
Now, you mentioned earlier that switching to bpMRI might lead to a slightly higher number of those equivocal cases, those gray areas where it's not totally clear whether cancer is present or not.
Yeah, that's one of the potential downsides of using fewer sequences.
Okay, so can you explain that a bit more? What happens in those uncertain cases? What are the options?
Well, one approach is to use DCE selectively, like as a backup option for those tricky cases where the bpMRI results aren't crystal clear.
So if the bpMRI is like, not sure about this one, then you bring in the DCE as a tiebreaker.
Exactly. It becomes a targeted tool rather than a standard part of the initial workup.
Okay, that makes sense. So DCE doesn't go away completely. It
Yeah.
just becomes more of a specialized tool.
Right. And another idea that's being floated around is to develop a whole new PI-RADI scoring system, specifically designed for bpMRI.
Wait, back up a sec. Remind me what PI-RADIS is all about.
Sure. PI-RADI stands for Prostate Imaging Reporting and Data System. It's basically a standardized way of reporting and scoring the findings from prostate MRIs.
Okay, so it's like a common language that all radiologists use to communicate about the likelihood of cancer.
That's a great way to put it. It helps ensure consistency and accuracy in how we interpret those MRI images.
So why would we need a separate PI-RADIS for bpMRI?
Well, the current version of PI-RADIs was designed specifically for mpMRI. It takes all 3 sequences into account. So when you remove DCE from the equation, the scoring system might not be as accurate or reliable.
Ah, I see. So we need a system that's tailored to the specific nuances of bpMRI.
Exactly, a system that's designed to make the most of the information we get from just the T2WI and DWI sequences.
Okay, so a new PIRA for bpMRI, that's something else to keep an eye on.
Definitely.
Now, we've talked a lot about the technical side of things, but what about the human factor? How does the expertise of the radiologist play into all of this?
Oh, that's a great point, and it's something that this study actually looked at as well.
Oh, really? What did they find?
Well, they found that the DCE sequence was actually more helpful for less experienced radiologists.
Interesting. So for those who are still learning the ropes of prostate MRI interpretation, DCE might act as a bit of a safety net.
You could say that. It gives them a little extra information to work with, which can help them make a more confident diagnosis.
But for those seasoned pros, the experts who've been reading prostate MRIs for years, they might not need that extra help.
Right. They might be able to make an accurate call based on just the T2WI and DWI alone.
So experience matters.
It definitely plays a role. The PIR steering committee even came out and said that bpMRI might be best suited for those expert readers, the ones who are really confident interpreting images without DCE.
So it's not just about the technology, it's about the skill and experience of the person reading the scans.
Absolutely. It's a team effort.
Okay, so we've got a lot to consider here. Image quality, biopsy protocols, the expertise of the radiologist. It's not just a simple switch from mpMRI to bpMRI. There are a lot of nuances to think about.
Exactly. It's not a one-size-fits-all situation.
So what's the takeaway message for our listeners? What should they be thinking about when they're discussing these options with their doctor?
Well, first and foremost, I think it's important to remember that both bpMRI and mpMRI are valuable tools. Neither one is inherently better than the other.
It's about finding the right tool for the job.
Precisely. And that's where that open communication with your doctor comes in. Don't be afraid to ask questions.
Right, like what are the pros and cons of each approach for me specifically? What are the things I need to consider?
Exactly. And don't hesitate to ask about the expertise of the radiologists at your facility. Find out if they're comfortable reading bpMRI scans, if they have a lot of experience with this technique.
Yeah, expertise matters. I definitely want to know I was in good hands. What else should you ask?
You can also ask about the image quality protocols. What steps do they take to ensure high-quality images? Do they have any external certifications or participate in quality assurance programs?
Right, because if those images aren't clear, you're not getting the full picture.
And it's smart to ask about their protocol for handling those equivocal cases, those gray areas where the results aren't totally clear-cut. What are the next steps if the bpMRI findings are uncertain?
So you're saying have a plan in place for dealing with uncertainty.
Exactly. And I think ultimately, the most important factor is your individual needs and preferences. Are you primarily focused on avoiding unnecessary biopsies, or is maximizing diagnostic certainty your top priority?
It's all about personalizing the approach.
Exactly. What matters most to you? What are your concerns? These are things to discuss openly and honestly with your doctor.
Because healthcare isn't one size fits all.
Absolutely. It's about finding the approach that best aligns with your individual values and priorities.
All right, that's a great point to end on for this segment. Let's take a quick break to gather our thoughts, and we'll be right back with some final takeaways and a little something to ponder. All right, we're back, ready to wrap things up. I don't know about you, but I'm feeling a lot more informed about bpMRI and mpMRI now.
Yeah, we've covered a lot of ground.
We have. It's fascinating how this field is constantly evolving. I mean, who would have thought we'd be talking about potentially ditching contrast agents for prostate cancer diagnosis?
It's pretty remarkable, isn't it? And it really speaks to the power of research and innovation.
Absolutely. We're always looking for ways to improve patient care, to make things safer, more efficient, more comfortable.
Right. And sometimes that means challenging the status quo, looking for new and better ways to do things.
And that's exactly what's happening with bpMRI.
It's shaking things up, forcing us to rethink our assumptions, which is a good thing. It keeps us on our toes.
I like that, shaking things up. So where do we go from here? What's the takeaway message for our listeners?
Well, I think the main point is that there's no one-size-fits-all answer.
I knew you were going to say that, but you're right. Every patient is different.
Right. Everyone has their own unique set of circumstances, their own priorities, their own risk tolerance.
So how do you navigate that? How do you make the best decision for yourself?
That's where the conversation with your doctor is so crucial. Don't be afraid to ask questions, to express your concerns, to really get into the nitty-gritty of what matters most to you.
Your doctor is there to guide you, to help you weigh the pros and cons, to ultimately come up with a plan that feels right for you.
Right, and that plan might involve bpMRI, it might involve mpMRI, or it might involve a combination of both.
It's about having options, and it's about choosing the option that aligns best with your individual needs and values.
I think that's the beauty of where we are right now in prostate cancer diagnosis. We have more options than ever before.
And that's a good thing. It gives us more flexibility to tailor the approach to the individual patient.
Exactly. And I think that's a really important point to emphasize. It's not about bpMRI versus mpMRI.
It's about finding the best path for you.
And that path might look different for everyone.
Yeah, exactly. That's the beauty of personalized medicine, recognizing that we're all individuals.
And that our healthcare should reflect that individuality.
Absolutely. Well said. So as we wrap up this deep dive, I want to leave our listeners with something to ponder.
I'm all ears.
Imagine you're sitting in your doctor's office and you're faced with this choice, bpMRI or mpMRI. What are the factors that would weigh most heavily on your mind?
Ooh, that's a good one. It really gets you thinking.
Yeah, what's most important to you? Is it minimizing the risk of unnecessary biopsies? Is it getting the most comprehensive information possible, even if it means a longer or more expensive scan?
Or is it minimizing your exposure to contrast agents?
Yeah.
Even if it means a slightly higher chance of an inconclusive result. There's no easy answer.
Exactly. And there's no right or wrong answer either. It's a personal decision, and it depends on your individual values and priorities.
And it's a decision you don't have to make alone.
Right. Your doctor is there to guide you, to answer your questions, to help you weigh the options. So talk to your doctor, be an informed patient, and make the choice that feels right for you.
Couldn't have said it better myself.
All right, everyone, that's it for our deep dive into the world of bpMRI and mpMRI. We've covered a lot of ground today, explored the research, discussed the pros and cons, and hopefully empowered you to have more informed conversations with your doctor.
It's been a great discussion. I've really enjoyed it.
Me too. Thanks for joining us today. And to all of our listeners out there, thanks for tuning in and stay tuned for our next deep dive. We'll be back soon with another fascinating topic to explore together.